Deliverable 7, the Quality Improvement Plan, presented by Mike Norby for Rasmussen College, being submitted for Kimberly Willis's Quality Improvement in Healthcare course. About us. Chaparral Regional Hospital is a small urban hospital of approximately 60 beds and offers the following services: emergency room, intensive care, surgical care, obstetrics, diagnostic services, some rehabilitation therapies, inpatient pharmacy services, geriatric services, as well as consumer physician referral services. Quality methods background. Before we can understand quality improvement methods and how they affect the healthcare industry, we must first understand the words that supply the phrase. Quality is defined as a degree of excellence. Improvement is something that enhances value or excellence. Quality improvement is a systematic, formal approach with efforts to improve performance. The QI process involves establishing a culture of quality, determining and prioritizing areas of improvement, collecting and analyzing data, communicating the results, committing to ongoing evaluation, and spreading the success. A variety of approaches exist to help you collect and analyze data and test the change. While it's important to choose a reputable QI model to guide efforts, it's more important that our organization fully commits to using the QI process and good QI practices. Patient experience encompasses the range of interactions that patients have with the healthcare system, including their care from health plans and from doctors, nurses, and staff in hospitals, physician practices, and other healthcare facilities. The patient experience can include timely appointments, easy access to their own information, open and honest communication, among other aspects that center around the delivery of their healthcare needs. Patient experience versus patient satisfaction. Patient experience is the questioning of whether or not a patient received a certain service and how often it occurred. Patient satisfaction refers to whether or not a patient's expectations were met. This can vary person to person, so two patients receiving the same care can give different responses. The evaluation of patient experience along with their satisfaction is essential in providing the best quality care possible. CAHP, or Consumer Assessment of Healthcare Providers and System Surveys, were developed by the Agency for Healthcare Research and Quality, focusing on patient experiences and areas such as the communication skills of providers and the ease of access to healthcare services. Questions that can be included in these types of surveys could include: is there any way that we can improve our services? This question opens up discussion from the patient standpoint to provide us, Chaparral Regional Hospital, with valuable information on how our patients view our organization, as well as input on what can make their experience better in the future. Another question that can be included would be, how easy was it to schedule an appointment with your healthcare provider or physician? The ease of scheduling an appointment is the starting aspect of the entire experience within our organization. If it is difficult to schedule an appointment, patients are not as apt to return, thus losing their business and, most importantly, their trust. There are several quality methods in order for healthcare facilities to improve quality, two of which are Six Sigma and SMART. Six Sigma focuses on understanding and controlling a process with the use of quantitative tools. Oftentimes, Healthcare organizations struggle in creating objectives that accurately measure progress toward their goals that are important to the organization and its stakeholders. For Chaparral Regional Hospital, by implementing a Lean Six Sigma approach to long wait times, our healthcare organization can reduce waste and provide faster turnaround times. This is accomplished through 5 steps. The first step is defining the patient's problem. In this case, it would be long wait times. Step 2 is measuring the process by collecting data and determining a baseline. We can accomplish this by conducting the timing of patients waiting and determining the average time. Step 3, analyze and identify sources and determine the root causes. In our case, were physicians seeing too many clients? Schedulers not providing enough time for physicians and patients? There are many different factors that could determine the root of our issues. Step 4, begin improvements by eliminating defects. This reduces the number of clients and/or providing adequate appointment time. Step 5 is controlling future performance with standard and process controls. We will do so by defining the standard that we will continue to reduce waste and defects by implementing adequate strategies. SMART, or specific, measurable, achievable, relevant, and time-bound method, is a healthcare organizations often rely on creating SMART objectives. Specific is well-defined and clear. In this case, our physicians will be required to participate in colleague coaching. Measurable is deciding that what will be measured to show improvement. In our case, physicians will be required to participate in colleague coaching, resulting in a 90% satisfaction in patients through physician communication. Achievable is ensuring that the goal is within the reach of the organization. So we will add to these previous statements by stating physicians will be required to participate in colleague coaching, resulting in a 90% satisfaction in physician communication. The coaching will be provided by Chaparral Regional and executed by a member of senior leadership. Relevant, is it important to the organization or stakeholders? Does it relate to the mission, vision, or other organizational goals? We will continue on by saying physicians will be required to participate in colleague coaching, resulting in a 90% satisfaction in physician communication. The coaching will be provided by Chaparral Regional and executed by a member of senior leadership. This training is important for the organization to succeed in providing the best care and service to our patients. All physicians will be required to participate. Time-bound. This sets time parameters and gives us a conclusion that shouldn't be too soon to hinder success or too far to promote procrastination. Physicians will be required to participate in colleague coaching, resulting in a 90% satisfaction in physician communication. The coaching will be provided by Chaparral Regional and executed by a member of senior leadership. This training is important for the organization to succeed in providing the best care and service to patients. All physicians will be required to participate. Trainings will be completed within 60 days of performance evaluations. It is recommended that all quality improvement teams should consist of one member of each of the following roles. Therefore, Chaparral Regional Hospital will enlist a member from our clinical leadership, which is an individual that has the position and power to test and implement changes while solving problems that arise during the process. A member with technical expertise. This individual has a deep understanding and knowledge of the area or areas that need improving. A member of our day-to-day leadership, and this individual is a QI team leader and ensures completion of the team's tasks. Lastly, a member of our project sponsorship. This individual is an executive within the organization that directly links the QI team to the senior leadership of the company. Members of the Chaparral Regional Hospital Quality Improvement Team will include our CEO or Chief Executive Officer, at least one medical director, at least 2 physicians, at least 2 members of the nursing staff, 2 members of our receptionist or administrative team, 2 members of our billing department, 2 patient representatives, as well as 2 case managers. Patient satisfaction is of utmost importance at Chaparral Regional Hospital. This is always proven through our committed efforts to improve our services. We strive to ensure that our patients feel comfortable, understood, and heard throughout their time visiting us. As we send surveys to our patients and staff, we expect to better understand areas in which we must improve upon. Our data collection comes from our trusted partners at IBM, as well as our in-house data collectors. Each data collection is secured using the most advanced software available to healthcare organizations to ensure confidentiality, as well as our patients' security when transmitting their medical information. Through surveys, we have found that the overall impression of the patient's visit is at 75% satisfied, who responded with a 5 or a great on overall impression, while 25% responded with a 2 or fair or lower on the overall impression of their visit. The survey also showed, in terms of willingness to return, 78% of patients responded with a 5 or a great on willingness to return, while 22% of patients responded with anything lower than a 5. Our survey also showed that under facility and convenience, the indicator with the highest percentage of 5 or great was the comfort while waiting. The indicator with the lowest percentage of 5 or great under this category was waiting time in the waiting area. In regards to our staff continue to provide the best quality care for our patients. That is evident in our patients rating our staff as friendly and helpful. Chaparral Regional employees are provided ample trainings in order to provide this quality to each and every individual that seeks treatment. Employees are required to complete trainings on customer service as well as quality improvement in healthcare to ensure patients are treated fairly. The lowest indicator in the area of staff shows that our staff do not inform the patients of procedures in a manner in which the facility should. It also shows that we do not respect modesty in the ways that are deemed appropriate. We will provide trainings from leading experts in these areas so that those areas can be improved as best as possible. Next, we see what is the mean or the average waiting time in the reception area, as well as the average waiting time to see a healthcare professional. While these numbers are high, we will strive to ensure that we can lower those to the best of our ability. Implementing the quality improvement plan. In order to implement such a plan, we must first define the mission and vision of our organization. It is the mission of Chaparral Regional Hospital to provide compassionate, accessible, quality, and cost-effective healthcare to our community by promoting health and educating our healthcare professionals by participating in appropriate healthcare educational opportunities. Chaparral Regional Hospital's vision is that we will be a leader in innovation by dedicating our healthcare facility in the advancements in health and transforming the lives of our patients through exceptional clinical quality, patient-centered results, and unmatched physician commitment. We will then collect and analyze data. As we previously talked about, data collection through our trusted partners at IBM, as well as our own data collection team, will ensure that we understand areas that we excel at, as well as the areas that we require improvement upon. These processes are the heart and soul of the overall QI plan, as it gives us the information needed to improve. This will assist us in measuring our inputs, processes, and outcomes in a proactive approach, supporting our practice decisions for patient care. While most healthcare facilities will complete this on an annual basis, we will strive to complete this quarterly by sending surveys to our team as well as patients who have encountered our facility within that time period. We will then communicate the results through transparency and open communication with our entire team. Results should be transparent and communicated to our staff, physicians, and patients. Once our data collectors have received and inputted the results into our system, they will ensure that those results are transferred to our board of directors and senior management team. These individuals will distribute the outcomes as they see necessary to the appropriate members of our organization to ensure that we have the opportunity to improve. We will also continue monitoring. These will be accomplished by continuing monitoring areas for improvement outside of the typical QI methods by evaluating member complaints, providers, over and underutilization, clinical quality or safety, as well as administrative quality indicators. And here are the references that assisted me in compiling the information needed to create this presentation.